Welcome to Medicine Handy Point. Today we will be discussing how to take history from a patient presenting with the shortness of breath. So, first, as usual, we will start with the onset. We will ask that when did the shortness of breath started, then for how long the patient is having the shortness of breath. Then we will ask progression, whether the shortness of breath is it getting worse or not. We will also ask whether the shortness of breath is continuous or it comes in bouts or means intermittent. Then we'll ask about the precipitating factors, which includes like it does the shortness of breath occur with exertion or lying down, like orthopnea, or it is present all the time at rest? So these are the precipitating factor. Then we will ask about the relieving factors, like does the shortness of breath get better with taking rest or taking sublingual nitrates or some kind of inhalers. So that will give us a brief idea what's going on. Then we'll go into system wise. So first we will ask a question regarding the cardiac condition, like we will ask, is the shortness of breath is associated with chest pain, palpitation, orthopnea, pnd, edema? So that will help us rule out different cardiac condition which can lead to shortness of breath, like coronary artery disease, congestive cardiac failure, and arrhythmias. Uh, will also include any congenital and structural abnormality before in the past as well. Next, we will ask question regarding the respiratory system. So our focus will be on a cough, whether the patient is having cough or no. We'll ask about dry or productive cough. Then we'll ask about hemoptysis, sputum production, which may tell us about any infection, underlying malignancy. We'll ask about any wheezing, which will tell us conditions like pneumonia, interstitial lung disease, asthma, and COPD. So that will give us whether the shortness of breath is because of the respiratory problems or not. Then we'll ask about symptoms associated with the renal problems. So the best question is to ask, does the patient has noticed any reduction in the urine output? Next, then we'll ask about some neurological condition which can cause shortness of breath. These include myasthenia gravis and GBS. So we'll ask question relating to myasthenia gravis and the GBS, which will help us what's going on. Then we'll ask question about hyperthyroidism, as it is also associated with shortness of breath. Then we'll ask about history of any DVT in the past or pulmonary embolism in the past, and family history of thrombophilia, because patient may be having family history of thrombophilia and now may be presented with shortness of breath because of pulmonary embolism. Then we'll ask question about the fewer raised giant pain in the context of vasculitis, and vasculitis leading to pulmonary vasculitis. In the past history, we will again ask about any cardiac issues, any pulmonary embolism in the past, and any respiratory problems like COPD and asthma in the past. In the family history, we will specifically ask about cardiac condition, asthma, and thrombophilia especially. History should be sought out, as is OCP used in the female patient can lead to shortness of breath be due to pulmonary embolism. Appetite suppressant like fenfluramine is associated with pulmonary hypertension, so we should ask question regarding that. This is all about shortness of breath history taking. Initially we will start with OD para, the onset, duration, progression, and relieving aggravating factor, followed by by different system which can lead to shortness of breath, starting from cardiac, respiratory, renal, neurological conditions, and vasculitis, hyperthyroidism, pulmonary embolism. So our question should be then revolving around those conditions. I hope you like the video, and please subscribe to the channel.